BSI applied, is my scene safe? I'm going to assume my scene is safe. I'm going to determine the mechanism of injury or the nature of illness. Once I have that, I'm going to make sure this is my only patient. If this is my only patient, I'm going to go ahead and call ALS. I'm going to determine my patient has any C-spine injuries. If they do, I'm going to apply a cervical collar. I'm going to have my partner maintain a neutral inline stabilization of my patient. Then I'm going to go ahead into my primary assessment. I'm going to first determine my patient's AVPU. I'm going to do AVPU. Is my patient alert to person, place, and time? I'm going to ask my patient their name. I'm going to ask them what's today's date. I'm going to ask them what month it is. And then I'm going to go ahead and ask them their chief complaint. Then I'm going to go ahead and go into my primary. I'm going to check my patient's airway. I'm going to assume my patient has a pain airway because my patient is talking to me. I'm going to ask for the respiratory rate and quality. I'm going to go ahead and apply oxygen by a non-rebreather at 15 liters per minute. I'm going to make sure my patient has equal bilateral chest rise and fall. Then I'm going to go ahead and go into my circulation. I'm going to check my patient's temperature of the skin. I'm going to check the color of the skin. I'm going to determine my patient's pulse. And then I'm going to check and control for any major bleeding. Then I'm going to go ahead into my history taken. OPQRST. What is the onset of this? When did it happen? Provocation. Does anything make this better or worse? The radiation, if it's pain, does the pain radiate anywhere? Severity, what's the pain on a 1 to 10? And the time, what time did this start? Then I'm going to go ahead into my sample. The sign is something that I can see. A symptom is something my patient tells me. A symptom would be a tripod. My patient's in tripod position, indicating my patient has respiratory distress. Then I'm going to go ahead and see if my patient has any allergies. Then I'm going to check my patient on any medication, any past medical history. Last thing my patient ate, last oral intake. Then I'm going to go ahead and check events leading up to this. Then I'm going to go into my secondary assessment. I'm going to auscultate the lung sounds. That's my pulmonary. Then I'm going to go ahead and check my respiratory rate, rhythm, and quality again. And then I'm going to go ahead into my vitals. I'm going to do a blood pressure. I'm going to check my patient's pulse. And I'm going to do the respiratory rate and quality again. Then I'm going to determine my patient is a priority 1. And then I'm going to go ahead and state the feeling pressure of my patient. My patient is a 27-year-old male complaining of difficulty breathing. I'm going to call stated field pressure of my patient. I'm going to do a medical report. I'm going to call the hospital. I'm going to say I have a 27-year-old patient. He's having difficulty breathing. He has asthma. His respiratory rate is such and such. His SpO2 is such and such. His SpO2 is improved since I apply oxygen by non-rebreather. Okay, so if any okay, so please check what I just said against the assessment sheet, and please let me know if I missed anything. If there's anything you would have done differently, I appreciate it. Thank you.